Good afternoon, everyone, and thank you for joining the League of California Cities webinar entitled Reopening Senior Center and Community Center Facilities. For those of you who don't know me, my name is Megan McKelvey, and I am the Manager of Department and Member Services here for the League of California Cities. As you know, safely reopening our senior centers and community facilities have been an important topic in our Parks and Rec roundtables. Our aging community is not only a vulnerable population, but our conversations during these roundtables make it seem that this population is vaccinated and ready to resume their classes and social gatherings. With the governor announcing the reopening of the state on June 15th, cities are pressed to reopening our facilities and have many questions on how to do so safely. Today, we have the California Department of Aging here to discuss some guidelines on how to safely reopen these facilities. Should you need any assistance, we have our contact information on the slide. Please feel free to reach out to Cal Cities staff members and we will help you as much as we can. Before we get started, I have a few housekeeping notes. Unlike the roundtables, this is a little bit different. Our webinar is being recorded, and you can find that recording at the League's website at cacities.org/guide to local recovery. Within a few days, we'll place this recording on that website. You can also contact any League staff, and we will send that recording to you. Unlike the roundtables, you are all currently muted, but there will be opportunities for you to ask questions at the end of the presentation. How do you ask questions? Well, our next slide, you can put your questions in that Q&A chat box. Please make sure that you put your name and what city you're with. You can also upvote by clicking that thumbs up if one of your colleagues automatically writes a question that you want to hear. We are, with time permitting, going to take verbal questions. Use that raise hand feature on your toolbar, and Derek and I will call on you and unmute you to have that verbal question answered. So, without further ado, we do have a guest moderator here today. Derek Dolphy is our legislative representative for community service and environmental quality. Derek, I'd like to give you a few minutes to open up the roundtable, the webinar, and introduce our speakers. Derek?
Thank you so much, Megan, and good afternoon, everyone. Thank you all for taking time out of your very busy day to join us to talk about this important topic. As Megan said, my name is Derek Dolphy, and I am the legislative representative that covers community services for the League of California Cities. I put my email in the chat box, and you can see it there on the screen as well. I do want to say that this is a very important topic, as you know, and Megan did a great job kind of laying the foundation here at the beginning. But as the state is going to be reopening in the next few weeks here, there's a lot of questions about how we do so and how we do so safely, especially for those who are most vulnerable in our communities, which are seniors and our aging population. So it's very important and very timely, I think, for us to put on this webinar with our wonderful panelists that I'll introduce in just a moment. They'll be able to talk a little bit about what's going on and some tips and tricks and things that we can do to make sure as cities we're following guidelines and while still reopening safely and helping get our seniors back out into the community and doing the things that they want to do. So without further ado, I would like to introduce our two speakers. First up is Michelle Davis. Michelle is a manager for the Department of Aging over the Older American Act programs. She has a master's degree in vocational rehabilitation counseling, and she and her husband are caring for an older adult and son with mental health challenges. So Michelle, we'll hear from her in just a moment. I'd also like to introduce Monique Nolan, who is the Deputy Director for the Ventura County Area Agency on Aging. Say that 3 times fast. Ms. Nolan has been with the County of Ventura for 30 years in various management capacities and is now responsible for the supervision and management of operations and services at the county. Ms. Nolan has witnessed the challenges as senior centers and seniors face as the time nears for reopening sites and activities for seniors. So please join me in welcoming both of our great speakers today, and thank you both for being here. I'm going to turn it over to Michelle to kick things off. So Michelle, the floor is yours. Thank you so much.
Thank you, Derek. Thank you so much. And So nice to be here this afternoon. And if anything goes wrong, we're going to throw it back to Derek. So that's what he said I could do. So if you have technical difficulties, if people can't hear, Derek is the person. So thank you, Megan and Derek, for this time this afternoon. We hope, Monique and I hope that this is the best hour of your day. So we wanted to talk a little bit about resuming in-person service deliveries. And as I said, Monique and I would like to discuss today a perspective of how we can assist you and your organization in hearing some considerations and best practices about resuming in-person service delivery from a Department of Aging perspective. And hopefully when we have time this afternoon for some questions and Q&A, and maybe even Monique and I might have time to ask a couple of questions as well. The Department of Aging oversees services that benefits our older adults in California with our partners called Area Agencies on Aging, or we say AAAs. We are all working through the situation, and we know that one size, one guidance, one reopening communication doesn't fit all. When we hear the word reopening, there are multiple variables, suggestions, considerations that we all have to be mindful about. Monique and I will be able to share some considerations and some best practices for you. But we also want you to know that we don't have all the answers. We wish we did, but we do have some resources for you that might be able to help you when you're talking to your colleagues and others get through this part of the pandemic. Thank you for changing the slide, Monique. In March of 2020, we all know older adults, along with all of us, were asked to stay in place so that we could be safe. Many of our services, which are supported by our Area Agencies on Aging, went directly to remote established protocol, meaning porch visits, home delivery services, and of course, as we are on Zoom calls, so that we could stay connected with our older adults and older adults with disabilities. Bring it to a year, almost a year and a few months later, as vaccine rates increased and COVID cases decreased, which is a good thing. Many of us, including you, are in the process of reopening our in-person services delivery. Slide 3. The state of California is preparing to move beyond the blueprint for a safer economy. Most recently, as you all know, the governor outlined the next steps for the pandemic recovery, in which it says, after June 15th, if vaccine supplies are sufficient for California's 16 or older to be vaccinated and hospitalizations are stable and low for fully vaccinated people, CDA's reopening guidance for the aging network is linked directly to the state's guidance on reopening the economy and protecting public health. And sometimes, you know what, it's subject to change because as we know, we get information quickly and daily on this current pandemic system, and our updates are supported by our federal partners and local public agencies. Next slide, please. We're in a transition and we understand that. And in response to the transition, the Administration for Community Living, ACL, our federal oversight, and CDA have offered our providers, the AAAs, of which Monique is with one, a lot of programmatic flexibilities, and a few of which she'll touch on today. The other thing that we'd also like to let you know is that we asked our partners to monitor and keep an eye out for state and local public health guidance and to follow their public health recommendations. That's what we'll be doing. The other thing that we will be offering is CDA will be hosting a listening room for our AAAs in the network to discuss the opportunities, the challenges, suggestions regarding reopening going forward, because we all know that after June 15th, it's going to look different than what it does today. So now I'd like to pass the baton on to my colleague, Monique Nolan.
Hello, I'm Monique. As Michelle pointed out, thanks Michelle for that overview at your level. I'll be talking about what reopening looks like at a local level. So my title is Guidance for Resuming In-Person Nutrition Services, and I'll touch on some other services as well. So in-person service delivery of the Older Americans Act, Title
Monique?
Oh, my picture won't stay back on. I wonder if it won't. There we go. Sorry about the technical
No.
difficulty.
No problem. That's what happens on a webinar. Let's start over from the beginning of yours.
Sure. Can you hear me okay? Very good. So we'll go over some reopening guidance. In-person service delivery of the Older Americans Act Title III-C nutrition programs during the COVID-19 pandemic will resume after the County of Ventura has reached and remained in Tier 4 status, which is the yellow status, for several weeks, or as Michelle said, after June 15th. Per CDA guidance, it will be at the VCAA's or this AAA's discretion to resume in-person nutrition services. However, final discretion will ultimately be made at the local level. Some things to consider when you're going to reopen is prolonged isolation. Seniors may still be wary of coming out to sites or engaging in any senior activities. Renewed social connections. Conversely, some seniors will be eager to get out, and you're going to have to monitor that social distance protocols are being observed. There's going to be the mask versus unmasked decision. You know, there's going to be heated opinions on both sides, so I encourage you to follow your local guidelines. Vaccinated versus not vaccinated. There will be heated opinions on this issue and necessary discussions for you to determine how you're going to serve seniors. Follow local guidelines and be wary of not providing equitable services. Be informative and not confusing. Articulate and memorialize the expectations for reopening. Be flexible and encourage the staff and the seniors to be flexible too. We've never been through a pandemic before. Reopening is new to all of us, and it's going to be an ever-changing landscape as we proceed towards normalcy. Some preparations that we're engaging in at the VCAAA is we're working with our senior nutrition program providers to ensure practical in-person service delivery guidelines are in place. And we've used some of our CARES Act funding to provide PPE equipment to the meal sites. Some suggested protocols that we're following at our congregate meal service sites are staff volunteer training regarding COVID-19 risk reduction measures, following cleaning and disinfecting protocols per COVID-19 industry guidance. We're implementing a phased reopening approach based on capacity limits. So phase 1, 50%, phase 2, 75%, phase 3, 100% capacity. We're also looking at implementing a reservation system to manage the seating capacity at the sites and making sure there's protocols for ensuring hand sanitizer and masks are available for staff and clientele. We're also engaging in protocols for physical distancing of at least 6 feet, including seating arrangements. So consider additional dining times if unable to seat all the participants at one time following the physical distancing protocols. Sorry, my video keeps going. Sorry about that. Consider outdoor dining if feasible, and consider continuing offering meal pickup or home delivered meal service to clientele who are reluctant or fearful to return to the congregate meal settings. For the home delivered meal program, HDM program participants are typically required to have in-person assessments. However, temporary accommodations may be permitted. HDM program assessments alternatives are virtual assessments for new HDM clients who are, again, like I said earlier, reluctant to allow others into their home to conduct assessments. Virtual quarterly HDM and HDM eligibility reassessments for clients who may be reluctant to allow others into their home. And as Michelle said earlier, program flexibility should continue no more than 6 months after a major disaster declaration, the MDD ends, and CDA will inform the AAAs once the MDD ends and the 6-month transition period to reverse the flexibilities begins. Some additional S&P requirements are donations. CDA does require that participants be offered the opportunity to donate towards the cost of the meal. However, due to present restrictions, not all participants have been afforded that opportunity. So some suggested protocols are placing a lockbox at the grab-and-go locations and curbside events, supplying self-addressed envelopes to encourage contributions by check in person or through the mail, distributing envelopes so participants can give their contributions to the home delivered meal drivers or the grab-and-go staff, and if feasible, adding an online donation options to organization websites. VC AAA has senior centers that are run by the county, by special districts, by cities, and by nonprofits. So we run the gamut. And 2 of our grantees plan to reopen on June 15th and have drafted their facility reopening plan. Another one of our grantees has recently celebrated a large in-person event abiding by current COVID-19 restriction in place, but most of our SMP sites that offer congregate meal services are still in the process of developing their reopening plans. So don't forget other senior activities. There's the fall prevention programs, there's other exercise programs, there's nutrition counseling, both individual and group. There's other senior activities, educational classes, group day trips, book clubs, lectures, continuing education. Have a reopening plan for these activities too. Michelle and I wanted to offer some resources for reopening. There's the Blueprint for a Safer Economy. There's guidance for dine-in restaurants, COVID-19 information and resources, guidance for area agencies on aging for coronavirus disease 2019, updated guidance for resuming in-person service delivery for OAA, ICAP, and ADRC, and of course, CDA's website. So Michelle and I want to thank you for your time. We're going to take some questions. I'm going to put my contact information up. I can be reached at monique.nolan@ventura.org or at the phone number you see on the screen. And I'm going to stop sharing. And I think it was too much for my screen to screen share and also the video. So that should come back just fine once I stop sharing so that you can see Michelle and I so you can take, we can take some questions.
That is okay, and we do appreciate your time. We do have some questions coming in. As you are thinking about your questions and you are either putting them in the Q&A or getting ready to raise your hand and ask a verbal question, just a quick reminder, all of our information will be posted on the League's website, cacities.org/guide to local recovery. So that will be on that website again, cacities.org/local recovery. And that will be where the recording will be and the handouts. Did I see any hands raised? But nope. Okay.
Hey, Megan, I did see one that asked if our PowerPoint is going to be available. So absolutely, we'd love to share that with everybody. So however you want to do that, absolutely.
Perfect. Thank you so much, Michelle and Monique. And we will post it to that website again. We do have a hand raised and it is, how do we open it up?
Jean Clark has their hand raised.
Yes. Can we unmute her line?
There you go. Go ahead, Jean.
Can
Hi,
you hear
Jean.
me? Hi.
Yes.
Monique, thank you for that. That information is great. We're working on, I'm from the city of San Pablo in Contra Costa County in Northern California. So just working on our reopening plans for the senior center. And I see that you had talked about doing a phased reopening based on capacity, right? So 25, 50, 75.
Correct.
So are you still planning to do that based on, what may or may not come out on June 15th? Because, what's been published so far is basically they're getting rid of all those requirements and almost any group under 10,000 can gather without restrictions. So I was just curious about if you had any thoughts about what you were planning to do, or were you planning to wait or still do a phased opening?
Sure, Jean, that's a great question. So we're working with the information that we have now. And as of now, we're planning a phased reopening. Should things change and we hear different information, that could change. So right now, the senior sites that we have, the senior meal centers, are working with the information that we have now. So we're planning a phased approach. And remember, that's just one tack to take. Again, just to ensure the safety of the seniors. And remember, no matter what, you're going to follow your local guidelines, of course, but you're also going to be taking the temperature of the seniors, if you will, and their comfort level of coming back onto campus.
Thank you.
All right, so we got a few more questions here in the Q&A. First one up from Margaret says, don't these guidelines end starting June 15th beyond the blueprint? I think we already kind of addressed that. Anything else you want to discuss on that, or?
You know, I think the resources that Monique gave are wonderful. And remember this transition, I know it feels really uncomfortable. And the information that's going to come out, people are going to do things differently after June 15th, depending on what county they're in. I would really, really stress, as we do, rely on that county recommendation and rely on your public health officials.
Great. Thank you so much, Michelle. Next question I want to talk about is from Nancy, who, and this might be for both our panelists as well as some folks out there attending the webinar. Does anyone have a reopening plan they'd be willing to share? So just want to give some space to that, and please, feel free to put that in the chat. I know there's already a lot of messages and people sharing information in there, so I would encourage you to do that. I do see, Megan, that we have one hand raised.
Let's go to the hand raised.
All right, go ahead, Albert.
Yes, good afternoon, everybody. My question to all would be, is there, do we have a green light to ask individual seniors if they've been vaccinated, and do they have to show proof of that, or, to that nature, without, falling into some sort of HIPAA violation? And also from some of our sites that are smaller, is there a plan also for those individuals that can't communicate to us on a reservation plan? If we have a reservation policy in place, but they can't because they don't have the capabilities of doing so. And if we're at capacity, are we going to be turning those individuals away? We only can say 15 and 20 want to come. Is there a plan in place? In this case, it'd be Monique. Do you have a plan in place to give 5 meals to go because those individuals don't have the availability or the space to come in, or because the senior centers themselves are meant not only for the nutrition piece but also for the socializing, the getting out, the activities and whatnot. And just because they don't have the capability or means to call in and do a reservation, how do we avoid any of that, not allowing them into the centers? Thank you.
Sure, Albert, that's a great question. And that's what I was alluding to in my PowerPoint about being careful not to making sure you're providing equitable services. So it's really looking through that lens of service and equity. And it's hard for me to give you a straight answer. It depends on where, what your location is. Do you have the feasibility of going outside? It's really about being creative. And it's an iterative process, seeing what works. But the most important thing is to make sure that all your seniors are served. Yeah, it's really hard for me to give you a specific answer on that. Michelle?
I appreciate that. It's gray, and I think, Albert, I want to go back to the first part of your question. And Monique and I had talked about this yesterday, is the vaccine question. So CDA relies on our public health recommendation, and I would have to defer to them when we're talking about something as important and as critical part of this rollout. And I would lean towards your public health authority in terms of getting you guidance with regards to vaccines. I know that's, yes, I think that I would rely on your public health authority. I know we want to give answers, but we got to be mindful and smart with this and minimize reduce as much risk as we can. And so I would say, I would defer to whatever county you're in, Albert, I would go to your public officials.
And Albert, I'd like to add that, whatever your public officials, following their guidance, if there's that you have a discussion with your staff about if there's going to be a vaccinated versus non-vaccinated section, that you're already prepared for how you're going to handle that. So that's my best advice at this juncture.
Yes, about as clear as mud, right?
Right, but it's an ever-changing landscape, but it's new for all of us. None of us have been through this reopening plan, and that's what I was talking about earlier. We just have to be flexible. We have to be patient. We have to communicate when we make a decision, that we articulate it, memorialize it, and make it because it's confusing for us, right? So of course the public, it's going to be super confusing. So we want to try to speak as plainly and make those decisions in advance of them coming back onto the campus, wherever that campus is.
Yeah, absolutely. A lot of grace that we'll have to give ourselves as this process moves forward. Someone else put in the chat, excuse me, in the Q&A, just to put a fine point on this about masks as well, right? We were talking about vaccinations. Is there any nuances or other things for masks, right? Because that might be, you're not necessarily denying public access. You're simply requiring something to enter the public building. So is there some nuance there that you'd like to expound upon?
Michelle, sorry.
So Derek, I want to make sure that we're being mindful of the community that we serve, and go back to what Monique had said as being equitable. So if you're going to rely on your public health authority in terms of those masking, sanitizing, social distancing, kind of those benchmarks of where we are in this transition period, I think it's going to be important to rely on those public health authorities in terms of those items that are so critical to a positive and sustainable reopening. Monique, I'm not sure if you have anything to add.
I'm sure. So to Michelle's point, and if you're able to providing those that for the clients, for the seniors and the people that come on campus, having the sanitizing, the module, where the sanitizer comes out, making sure whether it's in the bottle or something larger scale, having the temp checks, providing masks if you're able to. So if that's something protocol that your county, your local guidelines are telling you to follow, it's ideal if you can have all of that available for older adults when they come onto the senior centers.
Great, thank you for that.
For our members, we also want to invite you to put, if you do have opening ordinances that you want to share with one another, this is a time for you to share that in the chat box. So we do encourage you to put that in.
Thank you for that plug, Megan. Yes, I'm seeing lots of networking and exchanging of contact information. The chat is now the new business card, is what I said the other day. So it is odd, but we'll get used to it right when we don't have to use it anymore, right? I do see one raised hand, but before we get there, I do want to ask another question that's slightly different, similar topic, and that's really about cold and flu season. Someone had a question in the Q&A talking about bringing back social distancing and mask requirements, not for COVID necessarily, but maybe cold and flu season. So is there anything you would like to kind of talk a little bit about with your thoughts on how we factor in other communicable diseases such as cold and flu into our reopening that, I know we've been focusing on COVID, but obviously the flu is still very serious as well.
Thank you for that. And I'm not a doctor, and I think we always have to, Derek, I know you might think I am, but I'm not. I also think it's going to be important. I go back to public health authority and what those, and common sense, right? Common sense, good judgment. We're going to be going into the fall and winter time. There are going to be things that we need to do regardless of where we're at with the pandemic, and we want to be supportive. So I don't know if Monique can share from the AAA perspective, but I want to default and go back to relying on your public health authority for those specific guidelines in your county.
And I'll echo what Michelle says, but add that because of this pandemic, everyone's going to be more sensitive. And so there may be some natural, people may start wearing masks again themselves or socially distancing themselves. It's just we're more mindful of how we get sick. So Derek, to your question, and Michelle, to your point, is of course we're going to follow the local guidelines of the public health officials, but I think that a lot of self-regulations are going to start occurring again, just to protect oneself.
Great. And I think we have one hand raised. Megan, if you want to help get that person. All right, Cloris, go ahead.
Hi, how are you? Again, thank you so much for your information. Thank you everyone for the chat. I really do appreciate it. A question that I had, I guess for all, is for private clubs that are in your senior centers, are you asking them to submit a opening guidelines for their own specific club, or are you asking them just to follow what you or as the city have come up with in general? That I guess makes sense.
I'm giving me a minute to think. Cloris, are you go ahead, Monique.
So while you're cogitating, from our perspective, as I shared earlier, we have senior centers that kind of run the gamut. And so what we've asked is for them to submit the reopening plan, the procedures and plan for us to review. But we don't have any private clubs per se. I don't have that scenario. So I want to think about how that could be handled. And Michelle.
Right, and thank you, Monique. And we are not asking the AAAs to send us their plan, but we are asking this to have a conversation about it so that we can learn from each other. And so we are going to be doing that in the month of June after the June 15th. So, but we're not requiring them to submit their plan. We know that everybody wants to do good business, good practice, and be safe and successful and sustainable. And that's what the foundation of the AAAs are. So, Dolores, I'm not sure about the private gym part, but that's kind of how we're moving forward with the plans for our AAAs.
Great. Monique, there was a question for you in the chat from Christine asking if you would be willing to follow up with us with some examples that we could post on our website of reopening plans that your facilities have come up with. So if you'd be willing to do that, it sounds like some folks would really like to have us be able to send around some of those as well from your perspective. So just kind of want to throw that out there for you.
Yeah, I could probably do that. I can connect with you, Derek, and Megan to make that happen. And Michelle, of course, she's our governing body.
Yes, absolutely. Can't leave out Michelle.
Oh yeah, you can.
So lots of questions about, can we do this? Should we do that? Thoughts on that? I know we've talked a lot about that, so I'm going to skip over some of those questions, but please, if you have another variant on that that's more specific or something we haven't touched on, I would include that in the Q&A so that way we could get a different perspective. But one person that brought this up, and I know this is a little bit outside the scope of our conversation, but something that I think might be interesting if you have any comments on would be about OSHA and the workplace. And, how do we address some of the challenges that we might have with our own employees working in these senior centers? And, do you imagine that there'll be any restrictions around employees regarding COVID? I think that that's another interesting angle where we've focused so much on the seniors themselves. We haven't really touched on the folks that work in these senior centers as well. So any thoughts or comments on that?
Well, that's a very good point, and I would love to get more feedback on what people in the audience are running into. I have not, from my perspective. Monique?
Sure. So, there's been obviously some thoughts and considerations about that. Besides what we've reiterated time and again is following our guidelines locally. It's about the comfort level of the seniors that are coming on campus and protecting them. So, I would say from the standpoint of VC AAA, I can only speak for us. Is we like to follow best practices. And right now for us, from our Dr. Levin, our public health director, its best practices is to have those social distancing protocols in place, be wearing the mask, have the gloves. So, and unless that changes, I suspect that we'll be going along that vein for our employees at the senior centers. And when I say our employees, I mean our grantees, so.
Great. Another question, I assume this is more directed at Michelle. It's talking about, will the state or is the state anticipating releasing protocols specifically for senior centers? They say thus far they haven't seen such guidance. Anything that you can give us a preview on, Michelle, about forthcoming guidance or recommendations that can be applied statewide?
Sure, thank you. And so it's interesting because our role as a state entity is broad guidance that would help facilitate and the services that Monique's team is utilizing. And so on the website that I think Monique gave at the end of the presentation, we've broken out a number of amendments to our guidance with regards to nutrition support programs. So there are going to be some specifics, probably not as specific as everybody wants. It's broad, but I do anticipate after June 15th and we get going into this and get some feedback from our AAAs that we will be amending and coming out with additional guidelines so that we could be helpful and not confusing. So I would anticipate that. But as we know, June 15th is right around the corner. So many things can happen till then. But to answer your question directly, I do anticipate that we'll be coming out with additional guidance with regards to guidance that's coming up from the state.
All right, looks like there's one question in here that's directed at us as the league. So I'm happy to take that. It's talking about, have we determined as an organization what advice that we're giving cities in terms of the legalities of asking patrons whether they're vaccinated or not? I'm going to say that you should really consult your city attorney. You know, we always hesitate to give broad guidance because we want to make sure we get our recommendations right and we give you accurate information, and every city is a little bit different. So I would strongly encourage you to check in with your city attorney and also have them check in with their county public health official to make sure that what you're doing in your county makes sense and is following the proper guidelines, because it does seem that there will be a little bit of variation from county to county from what we've heard today about exactly what is required and what isn't, what's encouraged, what's not. So I'll hesitate to give you some broad guidance about thou shalt do this or thou shalt do that, but certainly want to encourage you to reach out to your city attorney to make sure that you're following those guidelines there. And I know that we have wonderful city attorneys that are way smarter than me on many of these legal questions. Another question that I have personally is, you know, what advice would you give a city who maybe is at the very outset of this, right? Maybe they really haven't thought through all the different intricacies. They're kind of at stage one, right? They're looking at the precipice saying, okay, we're getting ready to jump and reopen. What advice would you give a city who's in that boat as to like, what first step should they take on this pathway to reopening? You know, it can be daunting, right? To say, well, we've had our facility closed for over a year. How on earth do we bring everyone back?
That's a great question, and I think it makes sense. So I think the great news, if you have some cities that are in that situation, or you're just, a human being trying to figure it all out, right? I think that just based on the chat and the number of participants, you have a great network and resources within your own network and within your own league. So if I was a city and I was just trying to figure out, man, what do I do first? Look to my peers and get some example of your plans and make sure that you're always referring to your public health authority and keeping updated on the guidelines that are put out by them. And also, I say, look at what some other states are doing too. There's a lot of information regarding other states, although they're obviously other states, they're really good examples to what can be possible to do with going forward. So I think use your resources and then create a plan and a protocol. Monique, anything?
Michelle, you took the words right out of my mouth. It's leverage your network, attend sessions like this, listen, learn, review. And I'm also a big firm believer, I said this earlier, kind of taking the temperature of the population, your community and what they're interested in. Of course, what we've said repeatedly, the overarching message is to make sure that you're following your local guidelines. But all of what Michelle said and more, that leveraging the network, learning from others, looking at other states, attending these webinars, listening sessions, and then developing what works for you and your community.
Yeah, and as you said many times, Monique and Michelle, right, it's going to be a little bit messy at the beginning and folks are still figuring this out. And I saw in the chat, somebody said, well, who's the ultimate authority, really? Who has the final say? And so I want to tell everyone it's Michelle. No, I'm kidding. Yeah. So Michelle, Monique, can you guys talk a little bit about, who are if you're looking for information, right? If you want to go to the wellspring of information and make sure you're getting the most accurate, up-to-date information, and you want to follow the guidelines to the T, who are the regulatory agencies? Who are the folks that we really need to make sure we are bird dogging as closely as possible to make sure that we're getting the information straight from the source?
Good. I think the one that we have in common is our public health officials. And as a state agency, we're going to lean on the governor's office for also, and we also have our federal oversight. So Administrative for Community Living and the CDC. So I would say that those are probably our top from the state perspective, but I think the cities and what we all have in common is our public authority. Monique?
And I was going to say the same thing when the PowerPoint is released. The resources that I thought that were the most important for reopening is what I put on there is the Blueprint for a Safer Economy, which is CDPH, California Department of Public Health, some information from there. Of course, CDA is on there. If you look at the resources that I listed, I believe those are going to point you in the right direction that you need to go.
And I just threw in the chat the link that Monique just referenced to that Blueprint for Safer Economy so folks can check that out. Another question that came in, I think was more for Monique, is have you thought about, or are you contemplating keeping records of temperatures or proof of vaccines? Or, if you decide to go down that route, are you thinking about kind of retaining any of this information just to make sure if there is an outbreak, you can contact folks, or any insight into if a jurisdiction decides to do that, how they might go about doing that? I'm not sure if you can speak to that or not, but.
Sure. There has been discussion among the senior centers that are going to be open, and those that are further along in developing their reopening guidelines about taking temperatures and doing some of the things that you mentioned. Of course, it'll depend on what we're allowed to do, but there's definitely discussions about that. And I knew this. That's why I addressed it right in the outset of the PowerPoint. There's going to be discussions about those masks. There's going to be discussions about vaccinated, not vaccinated. Should we take temperatures? Should we keep that information? So we're going to be seeking more guidance. That's not something we're saying we're not going to do, but it's something that I urge in each of your areas, in each of your jurisdictions to be. That's why I said have those discussions in advance, be aware of what you can and can't do and how you're going to do it, if you're going to be able to keep that information, and always double check, make sure that you're following local protocol, because you don't want to be, I think Derek mentioned earlier, violating any HIPAA protocol, or I think it was Albert actually who talked about that. So Michelle, anything to add?
No, agreed, you nailed it. Thank you.
Yeah, thank you so much, everyone. You're just really having
questions.
fantastic questions. Yeah, we're really getting a lot of mileage out of the questions here in the Q&A box. Pivoting just for a moment to something else. Somebody mentioned, are there going to be any funding available or grant programs perhaps that you're aware of for upgrading ventilation systems for senior centers? Is the state, I haven't seen anything in the budget for this specifically, but just want to see if there's any pots of funding out there that either of you have been able to tap into or are aware of that might be able to help a senior center become, upgrade their facility so they feel a little bit better about bringing folks back.
Thank you. I know that we are looking forward to a number of pools of money. One would be the American Rescue Plan, which is still details more to come. So regarding a capital improvement like ventilation, I would hesitate to speak on that, and it just because as we're gray and I don't know, but it would be a very good question. Go back to your resources, have the discussions with your public authority, your team, your organization, and then bring it to this group like this so that we can find out what more detailed and how we could be supportive in terms of the funding.
And then I can reiterate what I shared in the PowerPoint presentation, that we, VCAAA, we provided some funding to our senior centers for PPE. So there's a precedent, at least from that perspective.
Great. All right. Lots of questions still remaining. And just to reiterate, when we say AAA, we mean Area Agency on Aging, not the other AAA. Just to make sure everyone knows what you're talking about.
Thank you.
It's different.
Just to reiterate. Okay, so another question that I had was, obviously there's lots of layers of government here, right? As Michelle just indicated, there's the federal government, there's state government, there's county government. Any tips or tricks or any advice you can give a city who's really trying to make sure that they know who the people that they need to contact are? Because sometimes it can be so confusing to know all the different players in this space, right? The county folks, the state folks, the federal folks. Any advice for folks to be able to coordinate better with their county, the state, and the federal government? Because it seems a little bit, like I said, daunting before to try and even know who all the people are that you need to come in contact with.
Sure, I would go back to Monique's statement in regards to the sources of the websites that she gave and the links. And I would encourage you, don't give up. Don't give up. Please don't give up. Keep asking questions, ask your resources. If I put my contact information, and Monique did as well. If you need to just run some things by us in terms of the what, the who, the when, the where, if we don't know, we'll find out. So I think the more that you can gain resources and business relationships to find the answers, because this is huge. And the great thing about it is that we've all in this together and we're all learning at the same time. So I don't know about, I just say tips and tricks, don't give up. And utilize myself, and Monique to support you in your efforts, because I know that you're all wanting to be safe and sustainable.
And I'll add to that, as you shared, Derek, I've been in the industry, I've been with the county 30 years, and back in the day was, exchanging business cards and making calls. And like you said, this is the new business card. So what I do is I actually, when people give me their email addresses, I keep them, I call them, I ask them, and then I make a note, and I have a little file electronically that says, these are important contacts for ABC. In this case, it'd be for reopening. So I say, don't be, you should always reach out to people to ask, because most people want to help you. I always just say, hey, thank you for your time. Could you just answer a few questions for me? Or could you point me in the right direction? So it's that old school technique of utilizing the business cards and going to lunch. We don't do that anymore. We get the email addresses and we email them. We ask them a quick question. It takes nobody more than a minute's time. You're grateful, you're thankful. I always say, hey, I'll repay the favor if you need me. And for me, that's the best way that I have found to get information and resources. And for this particular instance, reaching out to your local focal point for aging, which is an area agency on aging. Make a friend.
So I think we've kind of hit on, and Derek's been an amazing moderator, hit on almost all the questions, a little here, a little there. But I do want to add in, if anyone has a verbal question, we will be happy to take a verbal question, or you can write something new in the Q&A function.
And as we're waiting for folks to queue up, just a couple more clarifying questions from folks about the guidance that's forthcoming. Someone mentioned, will there be a memo from CDA about reopening before the 15th, or can we expect that sometime after the 15th? Like the timing on that memo.
Sure, thank you. So the guidance, the link that Monique shared is our and where we are currently in terms of the guidance. And then I would anticipate not on the 16th, but after we've opened a little bit and got some more feedback from our federal partners and our state partners, we would offer another follow-up. So after is a long answer for that.
Gotcha. Okay, and then any programs or services that kind of came out of the pandemic, arose during the pandemic that you would want to lift up and say that are great for cities to maybe adopt moving forward as on a permanent basis? I know like the Great Plates Delivered was an idea that kind of came out of the pandemic, and the necessity for folks to get nutritious meals and not having the ability to leave their home for fear of getting COVID before we had a vaccine. Anything else you'd like to draw our attention to that you thought, wow, the state did this, or the county did this, or AAA did this, and we like it. We'd like to continue that moving forward, because I think folks are starting to look towards best practices, and maybe we've learned some lessons during the pandemic.
Thank you for that. I think you nailed it. Great Plates is one that I was thinking of, the nutrition program and how insightful porch visits and home delivery has become. It's amazing. And I also want to, the friendship line. So our department is supporting a friendship line for individuals who are feeling isolated during this time to call and talk to a counselor. So those are two that probably are forefront in my mind with regards to, wow, we've done a lot well, but those two stick out in my mind. Monique?
And same for us. So we, part of our emergency COVID-19 response was to feed seniors and people with individuals with disabilities so they could stay safe at home. And to date, we've served more than 4 million meals. But the first thing that came, of course, the meals, we all know about that. But something else that came to mind, Derek, is that isolation has always been a problem for seniors. Of course, it was exacerbated by the pandemic. And a program that we rolled out in response to that, I don't know if you guys have heard about it, is the robotic pets. So if you look, there's a white paper that it says it's scientifically proven to improve mood, improve sleep, mitigate depression. And so we rolled out a bunch of those pets. So there's dog, cat, kitten, even to the seniors. And we just actually released a video today. You can go on our website and check out the video of some of the seniors and the individuals with disabilities receiving those pets. And I love what we do, what all of us do, because we have the opportunity to make meaningful change in the lives of people. And it's so exciting to me to be able to highlight those. And the numbers are important, the graphs are important, all of the things that we do, but actually getting to witness somebody who has experienced meaningful change in their life as a result of the meals that we provided them, the animatronic robotic pet companion we provided them, engaging in the Pearls program with our social workers, just being able to be part of that improvement, especially during these tumultuous times, has been amazing for my team. So
Yeah, and
robotic pets.
There you go. And I certainly encourage our city members to reach out to Cal City staff to let us know what things you liked and what services that we can help provide funding for or try and codify that happened during the pandemic moving forward. You know, happy to try and help on the policy front on this as well. I know a lot of folks reached out after Great Plates Delivered got up and running and really liked that it was, you know, federally funded and whatnot, and that it was a great help to some of our seniors. I think the last question here before we let our speakers go and we start wrapping it up, I know we've kind of talked about this in some angles, but here's another angle. So feel free to muse on this, is what if a city would like to delay opening up their senior center for a few more months? Maybe they are having staffing challenges. Maybe they're just still kind of waiting to see what happens, and they're concerned about spread of COVID. Any advice or thoughts or comments on folks waiting another month or two, but after June 15th to reopen, or any kind of thoughts on that?
Derek, thank you for bringing that up, because I think that since we're in transition and we definitely want people to open, right? So that we can start providing in-person services. But I go back to being safe and sustainable. I would definitely have the city check with their powers to be to make sure that this is a practice and a protocol that would be appropriate for their city. And I think that if someone made the judgment call that that was the path that they were going to take, and they've documented, let their powers to be know that I can't see why that wouldn't be supported. But while they are looking at their resources to go forward so that they can begin to reopen, because that's the goal, right? And so I hope that they would, if they have to take a pause, understand, but knowing that they're moving forward in a reopening scenario and developing their plan, looking at the resources. I think that we're all being flexible. So I would say just be flexible and be mindful of the steps forward.
And I would say something similar as being flexible, and that isn't unheard of, because again, the landscape is new. People are nervous. Some places have been closed more than a year. And to Michelle's point, it's about making sure that you're moving in that direction, perhaps communicating that to the public if they're clamoring for, like, why aren't you opening? What's happening? I think there's nothing wrong with that if they're moving in the right direction, communicating to the public. And I saw somebody, like, I don't see all the chats, but I see like brief chats that pop up. Somebody had talked about Zoom classes, which made me think that there might even be movement towards a hybrid model. Something to consider.
Well, Michelle and Monique, you've given us a lot of great things to think about. Before we wrap up, do you have any final thoughts for our audience to leave with?
Yes, thank you for the work that you're doing. Thank you so much. But maybe someone hasn't told you that you are changing and supporting lives. And it's so vitally important. And I wish personally, professionally, that you would all be safe, continue to be safe, and be successful. So thank you very much for your time.
I too thank you for your time. I thank all of you for your time. I know in this new age of Zooms, where there's no geographical borders, sometimes we get inundated. So I appreciate you giving us this time to have the conversations, because these conversations help us as well. And let's see, one salient point to remember is what I pointed out earlier. None of us have been through this before. Reopening is new for all of us. Just be patient. Know that it's an iterative process. Make sure you're communicating to the public in the least confusing way. And again, just thanks for this opportunity to the League of California Cities and to all of you.
Thank you all so much. A lot of your questions had a regional feel to them. I do want to plug our Parks and Rec roundtables. They're almost every Tuesday at 9 o'clock. You can see them or sign up for them at calcities.org/calendar. I want to thank our speakers. You're amazing. But I definitely want to thank probably one of my favorite, best moderators ever, Derek Dolphy. And Derek, you don't know this, but I like to give you the final word and to end the webinar. Derek?
Oh, goodness. Well, I would simply say continue to fight every day for your communities and to let us know how we at Cal Cities can help you get the resources, tools, policy changes that you need to do your jobs the best. And that includes, putting on webinars like this, connecting you with valuable resources like Monique and Michelle, as well as, putting things on our website and advocating for legislation that might be helpful in the next years and months to come that will help support cities and continue to move the ball forward to reopen safely. So just want to say thank you all for everything you do. And thank you to our wonderful speakers for being here today. And hope you stay safe, and we'll talk to you soon and see you on a roundtable.
Thank you very much. Bye.
Thank you, everyone. Have a good day.